And on the line we have Dr. Christine Hawke from the Animal Referral Hospital Dentistry Service. G'day, Christine.
Hi, how are you going, Brian?
I'm absolutely fine. There was a story recently about braces for dogs, and I thought, gee, isn't that new and innovative? But it seems that it's actually been around for quite some time. You've actually wrote about it on your own website some years ago.
Yeah. I mean, it's been around for a long time, I guess, with social media now. Just takes one dog to go viral. But the dog in the picture, I have actually seen it now, is very, very cute, and so I can see why it's gone viral. But it's one of those things that when I started doing dentistry only, people would say, do you put braces on dogs? And they think that was hilarious. And I'm like, yeah, sometimes we do. And with humans, we know that sometimes you have braces to correct something that's functional, so a problem with chewing or with your jaw. But a lot of the time it is a cosmetic thing, and so people confuse that and think that we're doing cosmetic surgery on dogs, which is not what braces are all about.
Right.
So which dogs are most likely to need braces?
It's to do with the position of the teeth and the way the teeth and jaw fit together, okay? So it's not to do with cavities or holes in the teeth or broken teeth. It's more if the teeth are in the wrong place. So there are certain breeds that tend to be predisposed to this. We call it a malocclusion, when their bite doesn't fit together properly. And that can be due to a jaw length issue, or it can be due to teeth being in the wrong position. And any combination of those will affect whether braces are suitable for the dog. I guess the thing that we mainly look at is the welfare side of it. So we don't do any cosmetic surgery.
Aha, that was my next question.
Yeah, we don't do it as an elective or a cosmetic thing. What we're trying to do is to give them a mouth that functions. So, for example, there are some breeds where there is a propensity for them to have their lower canines, which are the fangs. If their lower jaw is too short or too narrow, sometimes those fangs will actually go into the roof of their mouth. And so every time the puppy closes its mouth, it's biting itself. It's really painful. I mean, I always say to people, imagine if you put your hand in a puppy's mouth and let it bite you 100 times a day. That would hurt, but when the puppy's closing its mouth and biting the roof of its own mouth, they do get holes there, and they can end up with holes that even can go right through into their nasal cavities. So it causes a lot of pain and a lot of problems with eating, and they're the ones that we're looking at rather than the ones that just have a tooth out of alignment where someone wants them to look perfect for Hollywood.
And some certainly do want to do that. Are they still able to sort of chew bones and things like that?
Not while they've got the braces on,
right.
No. So when you put it in, it's like with a person. I made the mistake. I actually had braces when I was a teenager, and I kind of listened to my dentist and then thought, yeah, they don't know much. So I started eating Minties, and I was in the movies eating a pack of Minties. I know, and I actually pulled the whole side of my braces off, and I had a piece of wire sticking into my cheek. So
that was romantic. Were you on a date?
I wasn't on a date. No. I didn't do that kind of thing when I was that young. I was about 12.
Okay.
No, I don't remember what it was, but I just went out in a lot of pain. But so I mean, you have to be careful, and that's part of the thing when we look at animals that have a malocclusion, when we're deciding, because there are other options apart from straightening their teeth or putting their teeth in the right position with braces, that sometimes we have options. We might take a tooth out to make the mouth comfortable, or we might shorten a tooth. So, for example, with the fangs, lower fangs going into the roof of the mouth, we might decide if braces isn't a good option for that animal because it might be hard to control chewing, or because the teeth aren't in the right position for braces to work. They don't work in every case.
Yep.
It depends what the position of the teeth is. It's kind of like 3D Tetris. You've got to work out where things can move. So it's not always the same thing, but sometimes we can make the teeth shorter by doing surgery on the teeth. You don't just chop the tops off. You have to do surgical things to seal the teeth with fillings. But there are lots of different options, and I guess part of it for us is working out what the options are, and then looking at the mouth in 3D and the way it fits together, and working out what suits the dog best.
Just amazing, yeah. What about cats?
Do they wear braces?
Cats? I have not seen a cat with braces. One of the issues is that they don't make special little, the little brackets that you put on the teeth. They don't make them specially for animals that I know of. And so cats' teeth are a lot smaller. Apart from the canines, they're a lot smaller than human teeth. So trying to fit them on the front teeth of a cat would be hilarious. So I haven't seen it, but they do get issues, and I think people have moved canines or fang teeth in cats before. I just haven't seen it myself personally.
I love your technical terms there, fang teeth.
Fang teeth. Well, Well, the problem with cats is that canine is a dog, but it's also a fang, and then you end up with a canine or a feline canine, and
oh my goodness.
I tend to say fangs because otherwise people think it's the big tooth at the back.
You vets have all the fun. Dr. Christine Hawke, thank you very much from the Animal Referral Hospital.
Have a lot of fun.
And also, you've got a website, sydneypetdentistry.com.au, which I know you're going to upgrade very shortly, but we can still send people off there anyway, just to have a bit of a look at what you do.
Yeah, there's a bit of stuff on orthodontics and stuff there, so, if it's interesting to people, they're very welcome to give me a yell at the Animal Referral Hospital to chat about it.
Terrific. Good on you.
Fang advisor, Dr. Christine Hawke.
See you. Thanks, Christine.
Canine advisor. Okay.
Thanks.
Bye.
Bye.
Thank you. See you.